I'm Peter Block at TCT in Washington, D.C., and with me is David Smith from Brighton in England, and we are talking about the Amulet trial. So I'm going to do a little introduction here, David, if I can. Back in the old days, not so old, when left atrial appendage occlusion first came into studies, there were a lot of early complications and so forth. Amulet addresses some of this, but there are also some other parts of this. So I'm going to ask David, before anything else, what was your observational trial really designed to do?
So it's a 1,000 patient registry, prospective, observational, call-lab adjudicated. It's looking at safety of the implant procedure and subsequently efficacy. And so what we're reporting here is the early events. So early technical success and out to 7 days major adverse events.
Okay, so this is multi-center observational.
Yeah.
So again, let's go back to the early days. Lots of is maybe too much said, but pericardial effusions were an issue, perforations without effusion, loss of the device and so forth. What are you finding in your study?
So overall, there was a 2.7% MACE rate out to 7 days. So it's lower than in the early studies, but it's still not negligible. It's still a procedure that requires a great deal of care and attention to get it right and to avoid those complications.
Okay, we also say, and in this study, it was just the Amulet device, correct?
Yeah, that's right.
Okay, so one device, multiple centers, and in the long run, what do you hope to prove by this, David? You're obviously pleased, I hope, with the decrease in problems to start with, but nonetheless, you're still seeing them.
Sure, yeah. I mean, you're still seeing them. They're lower than they used to be. I think what we're hoping for, the full study follow-up is 2 years. And so, of course, during that time, we're looking for a reduction in bleeding events compared to the historical controls, a reduction in stroke compared to historical controls, and a continued low adverse event rate related to the device.
Well, thanks, David. It sounds to me like this observational study is going to set sort of the benchmark, perhaps, for future studies for left atrial occlusion.
Well, I hope so, yes.
So there you have it. Left atrial appendage occlusion is with us clearly, and sounds like things are getting a little bit better than they were to start with, though they weren't so terrible really at the beginning either. Thank you very much, David.
Pleasure.